You might hear about the health department's community health assessment work and think, this is great, but what actually comes out of this? That's a good question. Our community health assessment, or CHA, helps us gather important data, but it's the stories we hear along the way that bring that data to life and ultimately lead to actions that improve health in our community. At the health department, we use the CHA to guide our planning and programming. Community groups and residents also use it to improve health in small and big ways. Here are just 3 examples of different outcomes that have stemmed from CHA work in Washtenaw County. Our first story takes place in the MacArthur Boulevard neighborhood and Sycamore Meadows apartment complex in Superior Township. Health assessment data showed that this area was experiencing worse health outcomes than other nearby neighborhoods, so our health department staff teamed up with Alicia Spencer, a trusted community leader, to learn more through some focus groups. During this process, inadequate housing was identified as a primary issue negatively affecting health in this area. This sparked a new community organizing effort to make improvements. In May 2018, residents formed the Sycamore Meadows Tenant Association with the goal of improving the living conditions of our community through teamwork and communication with our neighbors. As a result of working together, some great changes have been made. Both Superior Township and the U.S. Department of Housing and Urban Development have taken action to ensure the property owner is complying with important housing regulations. New successful food distributions are hosted in the Sycamore Meadows Community Room in collaboration with food gatherers, and Superior Township has recently made improvements to the parks nearby. The Ypsilanti District Library built a brand new, full service library branch right down the street from Sycamore Meadows, citing community health assessment findings as a reason for expanding access to services in this area. Community members continue to organize and build on their successes to make sure the property owner and staff are responsive to their calls for action. Next, let's talk about the origin story for our Prescription for Health program. Back in 2008, our CHA data showed that the Ypsilanti area had high obesity rates and lower rates of people eating enough fruits and vegetables. We knew that there was also high food insecurity in this area and a lack of accessible grocery stores, which all contributed to this community's increased risk for chronic diseases. Because of this, our team decided to partner with the new Ypsilanti Farmers Market and local healthcare providers to start the Prescription for Health program. This program connects people to their local farmers markets through their medical clinics. Participants are given tokens that they can spend on fruits and vegetables at their local farmers market, as well as education and support from our staff to meet their health goals. Over the years, this program has expanded partnerships to many other area farmers markets, farm stands, and medical clinics, helping to support our local food economy and the health of participants. In 2021, over $22,000 worth of fruits and vegetables from farmers markets went to 440 community members in the program. Finally, we want to highlight how relationships that started with CHA work help create important, lasting partnerships that improve health. Prior to the COVID-19 pandemic, our team partnered with community members on a series of community health conversations. The goal of these conversations was to better understand the health issues affecting people's lives in specific neighborhoods and groups. This work led to the creation of Community Voices for Health Equity, a team of community leaders who meet regularly with health department staff to take action on health inequities. Once the pandemic started and our health department work shifted into emergency response, the relationships built through Community Voices became even more invaluable. We relied on these partnerships to share timely information, develop effective outreach strategies, and help connect people to resources. As things like masks, at-home tests, and vaccines became more widely available throughout the pandemic, they were not easily accessible to everyone. Partnerships with community voices and other groups were essential in connecting community members with resources to help protect them and slow the spread of COVID. Partners identified locations for events, developed promotional materials to spread the word, organized volunteers, and even hosted vaccine pop-up clinics and distribution events. Many of these relationships continue today and have led to new community-driven initiatives to promote health in Washtenaw County. These are just 3 stories of how child work can lead to meaningful, positive changes in our community's health. We look forward to seeing what amazing work lies ahead. We're grateful to all our community partners for their passionate and thoughtful work to help make Washtenaw County healthier. You can see more stories like this on the Health for All website. Thanks for watching.